Acute otitis media is common in the pediatric population and is a common source of antibiotic misuse. According to the Choose Wisely campaign, it is recommended that antibiotics are not routinely prescribed for otitis media in children aged 2 to 12 years old with non-severe symptoms when the observation option is reasonable. The American Academy of Pediatrics agrees with the recommendation and states that clinicians should prescribe antibiotic therapy for acute otitis media, bilateral or unilateral, in children 6 months and older with severe signs or symptoms. Those include moderate or severe otalgia or otalgia for at least 48 hours or a temperature of 39 degrees Celsius or above. Acute otitis media is more common in children due to them having shorter and more horizontal eustachian tubes that can more easily accumulate fluid than in older children and adults. Moreover, their immune systems are still developing. It is caused by upper respiratory infections leading to edema and inflammation of the nasopharynx and eustachian tube. Fluid is collected and then infected by the bacteria causing the upper respiratory infection. It's important that acute otitis media is diagnosed correctly. As stated by the American Academy of Pediatrics, acute otitis media can be diagnosed when children have moderate to severe tympanic membrane bulging or new onset of otorrhea. It can also be diagnosed when a child has mild bulging and recent tympanic membrane pain or intense erythema of the tympanic membrane. Children who are most likely to benefit from immediate antibiotic use include those that are under the age of 6 months. They have a temperature of 39 degrees Celsius or above, otalgia for 48 hours, bilateral acute otitis media, otorrhea, and marked bulging of the tympanic membrane, and severe pain that is not improved by analgesics. When antibiotics are indicated, a high dose of amoxicillin is the drug of choice. Some side effects of antibiotics include vomiting, diarrhea, and a rash. When antibiotics are not indicated, the treatment is pain management. Oral ibuprofen or Tylenol can be used to treat the ear pain, and for children with intact tympanic membranes, they can use topical Procaine, lidocaine, cincocaine, and for observation, there should be clear instructions on what to do if the child's symptoms worsen or if symptoms do not improve within 48 to 72 hours. Worsening symptoms include fever of 39 degrees Celsius or above, pain that is not improved by the medications I previously listed, and ear drainage. Evidence has shown that antibiotic use does not reduce pain in the first 24 hours. Most parents have ibuprofen or Tylenol for their children, so they don't have to pay for an additional medication. And also, this medication needs to be prescribed, it's not over the counter. UpToDate stated that evidence from several trials suggests that most children with acute otitis media do well with initial observation and analgesia. With or without delayed antibiotics, and that clinical outcomes and caregiver satisfaction are similar among children who are treated with initial observation or an immediate antibiotic prescription. According to Access Medicine, up to 80% of children with acute otitis media resolve without antibiotics. This shows that they should not be prescribed in all cases of acute otitis media. We learn about antibiotic stewardship, and this is a great example. If antibiotics are prescribed prematurely, the parents have to have a higher cost for those antibiotics, and there's a chance for antibiotic resistance and potentially medication non-adherence.